Hello, I chose to do my signature assignment on river blindness. River blindness affects over 40,000 people annually, and it primarily affects people in Africa, and there are some outbreaks in Yemen and Central America, and it's transmitted by the infected black fly carrying the parasite, the Oaklear, that word. And it's transmitted by black flies needing blood to reproduce, and they also need to live near fast-moving streams and rivers. And then the transmission occurs when female black flies bite a host already infected with the parasite. And then the life cycle of the black flies, the parasite undergoes, I think it's about 4 stages. The macrophage can live for up to 2 years, and then the larvae mature into adults within a year, and then the adult worms produce about 500 to 1500 macrophage daily for 10 to 15 years. And the parasite cannot live outside of the host. Once the individual is infected, it can lead to widespread exposure within the community. And then some symptoms that may appear are the symptoms may appear 1 to 3 years after exposure, and these symptoms include bumps under the skin, rashes, itching, visual impairment, eye redness, and swollen lymph nodes. And then in severe cases, which also include not getting treatment right away, can lead to permanent blindness, epilepsy, and then potentially death. And then to diagnose it, you would either need to get a skin biopsy to identify it. And then there also is eye exams where they can view the damage done to the eye. Blood tests are also a test that is an option, but it's not the best test because it cannot distinguish whether it's a past infection or a current infection. Some treatments are ivermectin is a primary antiparasitic drug, and it's administered every 6 months for approximately 15 years. And then doxycycline can target adult worms, while vaccines like mexidexin and that word also can help kill the parasites. And then some side effects of these treatments are joint pain, fever, nausea, and other systemic reactions due to the parasites dying inside the body. And then this disease can also impact the community because it cripples a lot of the community, because it is a disease that's widespread, because if one fly carries it, there's a possibility that one person is going to be bitten by multiple flies. And then it prevents the community from working significant, and it has an effect on the economy. And then chronic conditions result in the disease, including the skin and eye issues. And then there's also developmental issues with children. And then AI is being used to analyze tissue samples and expedite diagnosis with goals of finding new drugs and improving treatment protocols. These are my references.